Well, time for a slight change of direction. As the saying goes, the greatest wealth is health. Well, my next guest knows a thing or two about that. Professor Roger Reddel is a director at the Children's Medical Research Institute, and he joins me now in studio. Professor, thanks very much for your time today. Maybe just to start with, tell us a little bit about the Children's Medical Research Institute. I mean, what types of research do you do?
So Children's Medical Research Institute has been in existence for 55 years. And the types of research that we're concentrating on at the moment include cancer, embryology, so the study of embryonic development and birth defects, neurosciences, so how nerve cells communicate with each other, particularly related to epilepsy and related disorders, and also gene therapy. So this is a joint venture we have with the Children's Hospital, which is right next door to us, where the idea is that you could correct inherited diseases with genes as medicines.
How successful has the Institute been? I mean, in regards to potential breakthroughs?
We're very proud of our long history. So a lot of the early work that we did improved the survival of newborn babies, introduced vaccines which have saved countless lives and prevented lots of disabilities, pioneered microsurgery and so on. So a lot of these things have become part of routine paediatric health care, really illustrating that investment in research and donation to research goes on, giving for generations, essentially.
I suppose it sort of leads on to what I wanted to ask you next, and that's in regards to funding. I mean, where does the funding for the likes of the Institute come from?
Our institute has been very generously supported by the public right from the beginning. And it really goes back to how it was formed. It was essentially members of the public getting together and saying too many of our children are suffering and dying from diseases. They had a meeting in the town hall, literally, decided that they'd put together the funds to set up a research institute. And we've continued that level of engagement with the community ever since. So essentially 2/3 of the research costs are covered by ongoing donations from the public and investment income from donations that have been made in the past. And then the remainder of the research costs are funded by competitive grants from the National Health and Medical Research Council and various other funding bodies like Cancer Institute New South Wales, Cancer Council New South Wales, and many other funding agencies.
And now I understand you're undergoing a very important expansion at the moment, some $29 million expansion. Funding for that, where's that coming from?
Yes, we've got to the stage where we feel we've got a large number of very important discoveries that really need more people and facilities to take this forward to benefit children in Australia and elsewhere. So we've begun an expansion phase to house those extra people. The first phase, as you mentioned, will cost about $29 million, and $20 million of that has come from the New South Wales state government. So we've been very fortunate in that the Minister Skinner and Premier O'Farrell have provided $20 million of that money. We're still looking for the remainder, and had some substantial philanthropic donations, and we're looking for other sources of funding as well.
What will the expansion allow? What does it mean for the Institute?
What it means is that we can concentrate in those 4 areas that that I mentioned earlier.
Yep.
So we've taken the decision that really to make a major impact in these areas of research, we need to increase the strength and the depth of what we do. And that essentially means more brains, more hands working in those areas. So it will allow us to do those things, make an impact in cancer, epilepsy, birth defects, gene therapy.
And it's probably worth pointing out, I mean, this isn't simply for the benefit of the Institute itself, but I would have thought more broadly for health and sciences Australia-wide, globally, potentially.
Yes, absolutely. We'd be much more comfortable staying the size we were. We were doing just fine, thank you. But we really feel an obligation to basically to capitalise, to take advantage of the investment of previous generations in building the Institute to the place where it is now, to really use that as a launching platform to do much better and greater things in the future.
I mean, how would you describe the current landscape in regards to health and medical research here in Australia?
Australians have always done very well in health and medical research. I've never heard a contrary opinion to that. Australians just do medical research very well. It's reasonably well funded on a per capita basis, much less in the US. But having said that, over recent years the level of funding has been steady in Australia, whereas our colleagues in the US are suffering from rather large cuts in their funding. So it's very good in that regard, and of course we'd like to see that funding increase in the future. But it's steady as she goes, and Australian research is doing well.
What about challenges?
The challenges are mostly emerging health problems. I mean, in the paediatric area, 1 in 20 children is born with an inherited disease or a birth defect, and it's pretty much the same around the world. That statistic is a more or less universal statistic. We've done very well in Western countries in preventing or curing some of the major childhood illnesses that were common to many children. Now the remaining 1 in 20 suffer from mostly fairly uncommon diseases, rare diseases, which collectively are common. So it's a paradoxical situation where uncommon diseases are common. So there's increasing need for greater sophistication in the research to cope with those uncommon diseases.
Are we in an exciting time? Are we heading into a good time, opportunities and breakthroughs, do you think, in the space?
We are in a time where there are unparalleled opportunities.
Is that right?
There are a number of things that have come together. One is the Genome Project. So that's been finished a number of years ago, but the fruits of that are really becoming evident now. The power of the information in the human genome.
This is mapping the human genome.
Yeah, so going beyond the mapping to the code of the human genome. So and the cost of sequencing a whole human genome has come down by many orders of magnitude, and the potential for that. And the problems that that's going to provide. I mean, there are all sorts of ethical and privacy issues and so on which we're going to have to cope with. But the medical capabilities and medical potential within that is enormous. The power of computing, that is just opening up amazing possibilities and other instrumentation in research. So not just DNA sequencing, but other. And in addition, just the explosion of knowledge in molecular and cellular biology is opening up all sorts of possibilities in gene and cell therapy.
Considering the opportunities and the exciting times that they're currently facing and likely to do so more so in the future, coming back to funding, how important, obviously you mentioned that the 20 million coming from the state government, what about at the federal level?
Well, we'd like to see funding from the federal government as well. We understand that times are constrained, so we just have to live with that. But it would be very nice to see the federal government contribute to this project. Interestingly, in the 55-year history of the Institute, we've never asked for bricks and mortar funding from the federal government before, so this is our first time. We're also looking to philanthropists as well, and the philanthropists we've talked to so far have been very supportive and appreciate the value of what we're trying to do there.
Professor Reddel, good luck with it. Fantastic cause, and thanks very much for joining us this evening.
Thank you very much, James.
And that is all we have time for on this edition of Switzer. We're, of course, back tomorrow night.